Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And so today I'm very, very pleased to welcome Gina Pardino. Gina is a freelance nurse writer, a content creator, and published contributing author of 2 books. With her combination of nursing expertise and passion for writing, Gina educates the public on all things health and wellness. As a content creator, she uses various platforms to share her journey as a nurse writer, and she hopes to inspire other nurses to discover freelance writing as an opportunity in nursing. And Gina, welcome, 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 and thank you for being here.
Thank you so much for having me. I appreciate it.
It really is my great pleasure. First things first, Gina, why are you a nurse?
So it's actually a really funny story. I feel like a lot of people have a story that relates to like a family member who they saw the nurses work at the bedside and experienced that. When I was a child, I actually wanted to become an actor. And my father had told me that's not a real job. You should look for a job where you can actually have a stable life and living.
Mhm.
So I told myself I did want to get a job where I can help people. And my dad also he was highly influenced in choosing my career, as you can tell.
Mhm.
But he said, make sure it's a job where you'll always have a job. And I thought, well, nursing is a perfect fit for it. I could help people any way that I can. And it has ample opportunity from climbing up the clinical ladder to going to different specialties in nursing. So that's how I decided to go into nursing as my career.
At that time, did you have any idea how big it was?
I did not, no. And I think currently what I do now, I always think of the idea that, man, nursing like it has so much opportunities in the hospital, just the vast specialties. But
Yeah.
thinking outside of the box of the traditional roles, there's so much you can do with your license as a nurse. So I
Yes,
did
yes.
not expect that.
No, I don't think, well, at the time when I became a nurse, really, if I must be honest, at the time when I became a nurse, nursing was very much the traditional thing. This was, 49 years ago. So it was very much the traditional thing. In the last 15 or 20 years, I have seen nursing just blow up, you know? And I'm so very pleased about that. Um, because it helps us to garner the respect that I think we're due. So
I agree.
so anyway, having come to nursing, you know, on someone else's advice, it wasn't your thing, your heart was in acting. Um, what were the challenges for you?
The biggest challenge for me that I think what I should have done before I started as a nurse is I should have had a shadow experience. I felt like I was a very introvert as a child, so that meant I had to come out of my shell more often. And not to say that if you're an introvert, you cannot be a nurse. That's not what it is. But for me, it was very hard to be more open and communicative with just strangers. So but I believe that in one way, nursing has really helped me to be more open and social with others, especially doing something like this. I probably would have just backed away from the opportunity. And now I'm more open to take any opportunity that comes along the way. But I would say the other type of challenge going into the career would be that I would say that when I was exposed to new roles, for instance, when I was first assigned as a charge nurse role, I
Mhm.
was kind of thrown in the opportunity. I wasn't necessarily trained for the opportunity. And I think that given the fact that there's always been staffing issues, it's been happening even before the pandemic and
Yeah.
currently now after the pandemic. It's been something that I think I would have kind of understood even if I would have shadowed, and I would have really questioned myself if whether or not I wanted to be a nurse if I had that shadow experience. And one way
Mhm.
or another, I feel like if I would have shadowed, I probably would have not become a nurse. But I don't want to think about that because then I wouldn't be where I am today. So I feel that life has led me into the places that I needed to go through to be where I am today.
And you talk about being an introvert. You would
Mhm.
be surprised how many nurses I speak to who say exactly that.
Oh,
That
really?
they I keep saying, really? I don't know how it seems that the profession seems to draw introverts. So many nurses tell me, I'm really introverted. And I'm like, okay, if you say so.
Yeah. I guess it's just one of the many things from nurses that just it makes you open up on how many skills you actually really have. You just need to put
Yeah,
it to the test. So,
yeah,
and I
yeah.
think nursing is one of those. Yeah.
Yeah, one of the things I really like to say is that really it teaches you so much about yourself,
Yes.
and makes you grow in so many areas. As long as you're open to it, as long as you're willing to follow the path, it makes you grow in so many areas.
Yeah, I agree.
Yeah. So, what kind of areas did you work though?
So when I came out of nursing school, I was open to anything except med surg. I told myself I may not know where I wanted to go into nursing, but I'm 100% sure I did not want to go into med surg. So I give all the hats off to all the med surg nurses because I knew I could not do that. But I was open to anything as far as besides med surg to get into my skills. So I started at acute rehab. I worked primarily with brain injury patients, and I really liked that area. I still had a lot of experience on mastering my skills as a nurse with IV insertion, with
Mhm.
uh, G tubes, tracheostomies, and all that. And eventually, 2 years into my career, that's when the pandemic hit. So I was fresh, still felt like a fresh new nurse out of school, and no one would have anticipated to have experienced something like this. So
Mhm.
eventually, once the pandemic hit, I started having that burnt out feeling, and I thought maybe I just need to step away from the bedside. And that's kind of the luxury of nursing that I could step away from the bedside and then go back into it if I wanted to, if I was ready to do so.
Mhm.
And I decided to go into an outpatient experience, and I got a position into kind of like an internal transfer in the hospital that I was working in to become a dermatology nurse. So that was something very, very nice to experience. Especially like I had said, nursing it has a vast of specialties to experience, and there's only so much in nursing school that you can get exposure to those kind of
Yeah.
specialties. And I think dermatology is just one of those like hit
Yes.
or miss. If you get the opportunity, if you don't, you don't. So, and I
Mhm.
enjoyed dermatology a lot too.
Yeah. And the thing with dermatology is it's a much bigger specialty than people think it is.
It is, yes.
It doesn't have the glamour of something like cardiology or even vascular something or anything like that, but it's a lot bigger specialty.
It is, yeah, and I was very naive to think that I'm not sure if everyone in the audience that watches Grey's Anatomy will know about this, but there is a scene where the protagonists Meredith and Christina they
Mhm.
go to like the dermatology suite and they're
Mhm.
getting like their hands rubbed. It was very calm and relaxing. It was not like that when I walked in into the unit. So it like every specialty has its ups and downs. I was mainly just more, it's more of a, of course, it is more of a sit down position. I had to
Yeah.
do
Mhm.
triage calls. I
Mhm.
did assist with doing medical scribing, so assisting the doctors on typing what it is as they were doing their assessments on the patient, calling for
Mhm.
results, and doing any nursing education for patients that were starting on a new medication.
Mhm.
And so there was so much that I was doing in dermatology. It was not anything related to rubbing or giving massages. Also,
I'm glad you brought up Grey's Anatomy because that's one thing I used to tell students is that, nursing is not Grey's Anatomy. If
no,
what you're
it is.
looking at is Grey's Anatomy and you're thinking that this is what it's going to be, you're going to be in for a surprise. It's not anything like that.
Yeah.
So now though, you are freelance, right?
I do. Yes.
You're not in the dermatology clinic anymore. You just work for you.
Correct. I'm full time as a freelance writer now.
Love it, love it, love it. How did you get into that?
Oh my goodness. So I always tell people it's either destiny or a sign from God. But although my dermatology job, the responsibilities, the tasks of it were something that I could do on a daily basis. I had the holidays off, I had the weekends off. It was very unfortunate for me to say this, but it was a very toxic workplace environment. I had issues with a couple coworkers, and I felt that I was starting to dread my job, going into work every single day. And I thought, this isn't the lifestyle that I want. And I was slowly thinking that maybe I had chosen the wrong career path. So, at a moment of any other day that I was off from work, I was watching a YouTube video, and this advertisement came up of a nurse who had said, are you tired of your nursing job? Are you overworked? Do you not feel valuable as a nurse? Those kind of questions, like every single response to it was yes and yes.
Yes.
Like, how did she know? So she said, why don't you become a freelance nurse writer? And I thought, two things. I thought, what in the world is freelance? And two, I didn't know nurses could get paid to write. So she said, you can get my ebook for only $5. And I said, I'm going to put all my hope that's left in my career on those $5. And I purchased that ebook. And specifically, who this person is Elizabeth Haynes. She's the founder and creator of the RN2 Writer program.
Mhm,
I
mhm.
purchased her ebook. I resonated so much with her story and her journey as a nurse. And I thought to myself, I had written a book before, like you had mentioned in my bio.
Yeah.
I published two books before, which in fact I can kind of give a little brief explanation.
Do.
Before I became a nurse, I have connections with another wonderful mentor of mine who is a Latina, and she's a business owner herself for marketing brands. But when I met her, she created a foundation known as the Big Factor Foundation, and it's to help and motivate young Latinas to pursue their dreams, to get an education, and to become role models for other future Latinas. So in those connections, she wanted to create a book series for young Latinas to share their stories on their obstacles, on all the adversaries that they face, so that other young Latinas could also be motivated. And I ended up being a participant in that book, and that book is now published. It's titled as Today's Inspired Young Latina Book Series, Volume 1. So
Mm.
I felt that writing had opened up this passion of mine that I thought, oh my gosh, I want to be able to experience this again. But I didn't
Yeah.
study journalism, I studied nursing. So I
Yeah.
thought this was the only opportunity that there was. And so when I came across Elizabeth Haynes' story on being a nurse writer, I thought, this is kind of like where destiny is just bringing me along, and I can combine both two things, the passion of writing, the passion of nursing, and combine it into one single journey. And that's where I
Yeah.
am today.
Yeah. 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 I had the good fortune and the privilege of speaking to Elizabeth on this channel as well. So
Okay.
yeah.
Yeah, she's awesome.
Yeah, she is awesome. Yes, she is awesome. So, but you talk about one of the things you mentioned just now was your last job was the environment was toxic.
Hmm.
And that is something I hear very frequently, and I know to be true, actually, as a nurse myself for all these years, that very often the environments in which we work become toxic. How do you think we can change this? What would you like to see change?
If anything, I would like to see change that I wish that our when we walk out, I don't know if every single job does this, but there's always what's called an exit interview. And not a lot of
Hmm.
people, employees take advantage of that because they feel that their voices aren't heard, which may and may not be true. But I feel that we need our voices to actually be heard, and actually administrators or managers, whoever it is that is more in a higher up position, can actually take a stance and implement ideas and show employees that they're actually trying to make a difference to make some kind of change happen. And so that's what I think we could start by doing. First of all, for employees that are leaving because of a toxic workplace environment, that they actually voice their opinion through that exit interview, because there's no
Hmm.
point in complaining. Complaining is not going to get you anywhere. So that's what I did. I voiced my opinion. I said what I thought needed to be improved in the workplace that I left, and whether or not from there on out the administrative leaders can
Yeah.
do anything about it. That's my desire that I want for them, because the last thing I want is for someone else to walk in like I did, hoping that this is kind of like the place that I had envisioned to stay in dermatology for a longer term. In fact, I wanted to get a credential in
Yeah,
dermatology,
yeah, yeah,
but I felt that my lifestyle, my mental health especially, was just deteriorating just because of the toxicity of the workplace environment. So, if there's anything that I can say or recommend, is that anyone who is leaving, to do your exit interview, even if you feel like it's not going to make a difference, do it.
yeah, yeah. And and that's very good advice, actually. That's very good advice because eventually someone will hear.
Correct. Yeah.
Eventually someone will hear. Yeah. You mentioned earlier on about burnout, and now you're talking about, toxicity in the workplace. And one of the things I'm curious about is, especially in regards to burnout, is when does it start? When do we start noticing that something is happening? Is it early enough? Or
Mhm.
do we just keep pushing it to the background until, you know, it explodes? What do you think?
That's a great question. And you know what? I was actually lingering whether or not I was experiencing burnt out, because at first, it's very common as a new grad
Ah,
nurse to experience new grad anxiety. So how do you
mhm.
do like compare burnout
Yeah,
versus new grad anxiety? Because new grad anxiety is very common
it's
coming out of
real.
nursing school. So I
Yeah,
thought maybe it's just new grad anxiety. I would have pre-shift like anxiety where it's like, okay, now who will I have tonight? Are we going to
yeah.
be short staffed? But
Hmm.
I think the fact that I didn't address those situations or those symptoms, that's what ended up leading to burnout for me.
Yes,
And I think
yes.
that's something that if someone continues to have it after a year or 6 months, even, it's something that I should have addressed, to either speaking with a counselor or speaking with a mentor, or speaking just with the leaders in my unit, to say that, you know what, I still feel like I take home with me when I'm off work. I think about work, I think about like
Right.
possibilities that could happen with patients. And that's not really the lifestyle that you can live. I'm sure that other people have surpassed some way to balance out work and life. But unfortunately, or maybe others as well, were not able to, or it simply is not the area that you want to work or that you're meant to be in nursing. So I'm a lot better where I am now. I feel that I've I was told that I was good working at the bedside, especially from doctors, and I believe it. I love working with patients. I
Mm,
do miss certain things at the bedside. I feel like I am a kinesthetic learner, so I do more hands-on.
yeah.
And I do that because I type every day, but but it's not the same where I'm running around trying to pass meds and do all that jazz. But I can definitely say that, yeah, I think the first thing between identifying is if you continuously have those symptoms where you're anxious, you take work home along with you, then I think you need to speak to somebody and then see what your options you can have to either improve it or kind of figure out if you're destined to continue in that workplace environment.
And you just articulated that so well, but that is never actually, well, let me ask you, you're more recent out of nursing school than I am. Was anything like that ever articulated in your education process?
Mm-mm, no. Now that I think about it, I think that's just something that they should really start focusing in nursing schools, rather than
Mhm.
saying, well, this is how it is, and you just got to learn how to navigate through it.
Mhm.
It's just
Yeah,
not the way it's supposed to be. Otherwise, we're going to be in a continuous cycle of we're low with nurses. We're not low with nurses. We have nurses. No one wants to work in the conditions that they're being put in. That's the problem.
exactly. Exactly. And the license that we have, the
Hmm.
education that we have affords you the ability not to have to do that.
Correct. Yeah.
Right. And in a way it's fortunate and it's unfortunate, but we really need to pay attention more to the what we include, in my view, what we include in education. One of those things is recognizing signs and symptoms of burnout, because everyone will experience it on some level.
Hmm.
Whether it gets to the point where you throw up your hands and say, I can't do this anymore or not.
Hmm.
And self-care,
Yeah.
how do we care for ourselves in our attempt and our desire to care for others? How do we care for ourselves? And so that brings me to asking you what I ask everyone else. What does self-care mean to you?
That's a very good question. So I try to target like holistic self-care for myself. So physical, I try to eat more better. I try to eat more whole foods. I love to go to the gym. I feel that it just motivates me to defocus everything that's happening in my life. And I try to like push myself to physically get better. And then I also try to get enough hours of sleep because I did work the night shift. So hats off again to anyone who's still working night shift. I love working night shift, but it was not for me. So I try to get enough hours of sleep as I could, and I also take time to meditate as well. You know, for anyone, everyone's spiritual standpoint may be different, but I always
Yeah.
take time to pray, take time to read, even take walks as well. It's just kind of like a moment of kind of example of mindfulness as well, taking time being present in the moment and stop thinking about all the tasks that you need to do. There's a time for that as well, but time to be away from the phone as well, time to be with
Yeah.
your family, your friends. So that's the way I do my self-care.
Yeah. 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 And I ask that of everyone because I do want people to articulate what is it for them? Because very often we kind of skirt over it and don't pay attention to just how important it is,
Mhm.
and how it's different for everyone. It's
Mhm.
not the same thing for everyone. It's not even the same thing every day for everyone,
Correct. Yeah.
you know? And so, but I think it's really, really, really important that we pay attention to it.
Mhm.
What advice would you give to someone who wants to be a nurse now? You started out not really wanting to be a nurse, took the advice of your dad. Having taken it and gone through nursing school, you've realized just how much opportunity supported you. However, you've passed through it in different stages, and now you're still a nurse. You're always a nurse, but you're
Mhm.
not working in the traditional sense.
Correct.
And very often when you tell people you're a nurse, the only way they see you is in the traditional sense. So what advice would you give someone who wants to be a nurse?
So I would give him two advices. The first one would be if you can get the shadow experience, do it. And in fact, I had this conversation with someone over the weekend who wants to be so it's a young girl who wants to be a NICU nurse,
Mhm.
and I told her I will make it my life mission to try to get you the connections that I can. I don't know if I can, but I will try to do the effort to make it happen for her. But
Mhm.
if anyone is out there thinking of becoming a nurse, at least that they could get the shadow experience if they could. I know it's a little bit challenging now since there's been a lot of implementations and policies,
Mhm.
pandemic. And my second advice would be that if you are a nurse and you are thinking of moving away from the traditional role, to always remember that you are still a nurse. I hope even in my content creation role that I can demystify that, which is why I've decided to share my journey as a nurse writer through TikTok as a platform because it's not really widely known, and a lot of people are like, what is this? Just like I
Yeah,
was,
yeah,
and
yeah.
everyone's very familiar with just the bedside role, which is it's gonna will always forever be the foundational role. I
Yeah.
get because I've known it as well, but I feel that we are now moving into a position where you know the luxury of having a nursing degree, you can use it for so many things, and you are still a nurse regardless if you are not working at the bedside. So
Exactly.
I want to be able
Exactly.
to demystify that in social media for people and also just pay it forward that if I found this opportunity through YouTube on social media, I want to be able to do the same for others who are also struggling as well.
Yeah. Yeah. That's awesome. That's awesome. So, one more question. What would you say, in your view, would be the most essential quality of a nurse? In just one word.
Well, it's kind of two words, but I would say
Okay, two. I'll take
that
two.
they're a life learner. They are
Uh-huh.
life learners. So they're always going to be someone who continuously want to learn something, no matter what it is. You're never going to stop learning. You never want to stop growing. You're always going to keep looking and searching. You're not just going to stay stuck or stay where you are. You're always going to want to learn more. I think that's a quality that makes a nurse
Yeah.
to be a lifelong learner.
Yeah, yeah, I absolutely. This is the first time this particular one has come up, life learner. I've been asking nurses this question. So many words come up that describe nurses. And it's good that we describe ourselves in these ways, you know. Um, but life learner, that's a new one.
Yeah.
So thank you.
Yeah, of course.
Where do you see nurses and nursing in about 10 years or so?
I hope that my biggest desire, and I'm sure a lot of nurses would probably want this as well, that at least we could have some kind of update with staffing. Even though I no longer work at the bedside role, but I could just resonate with all the nurses who are currently working in the hospital, that
Yeah.
I hope there is some kind of way in 10 years from now that there's a better system on handling staffing for nurses. That's my
Mhm.
biggest hope right now for them.
Awesome. You know what? I hope so too. I hope so too. Not just for nurses' sake, for patients' sake,
Correct. Yes.
um, you know, for everyone, for the deliverers and the consumers, we really need to have better staffing.
Correct. Yeah.
Really need to have better staffing. Gina, thank you so much. I cannot tell you how much I've appreciated this. And especially as you are what, 5 years in?
5 years in. Yeah.
You're 5 years in. So thank you so very much, because now here you are really showing younger nurses that in a relatively short span of time, and you have to forgive me, from my perspective, it's a short span of time. I'm 40 plus years, but in a relatively short span of time, how much you can learn and achieve and expand in that time. And this is what nursing offers.
Yes, it does. Yes. And I'm very proud of where I am today, even though, like you said, it's a very short time, but better to do it now and early on in the stage of life than later on
Yeah.
where I feel like I've wasted all my energy in my career. I'm very happy where I am today.
Thank you so very much, Gina. I appreciate you being here.
Thank you so much for having me. I appreciate it.